Hi, I'm Dr. Eric Cram, and I want to talk to you a little bit about a program that we have here at the clinic that we've been doing for the last 10 years, very successfully helping people with allergies and sensitivities. Now, this covers a wide range of different things. We've helped people with dogs and cats, dust, outdoor pollen allergies, food sensitivities and allergies, whether it's wheat and gluten or milk or any variety of different things, just about anything. We've seen some success in being able to do this particular program. So I just want to give you a quick overview of what it all entails, how does it work, because honestly, there isn't really a name for it, so it's not an easy thing that you can just go online and try to look up and find information about. There's not really a name for this particular technique. Actually, what it is it's kind of a combination of a number of different techniques that have been around for a period of time and just pulled all together to make this system much more efficient and easier for the patient to be able to have success with. So one of the techniques that this is based on is called NAET. So those of you who have ever heard of that, or if you want to Google that, that's a technique that has been around for a long time. It's a neurological allergy elimination technique, and it's been very successful, but it's a bit complicated and it takes a lot of time and a lot of things on your part to make it be successful. And with the advent of lasers and with biofeedback and a variety of other techniques, we're able to condense this into something that works very quickly and very easily for you. So let me just tell you a little bit about how it all works. Now, it's vastly different than what you'll experience if you were to go to an allergist. And technically, I want to tell you that this isn't actually the treatment of allergies. We may communicate it that way because that makes the most sense in what you're familiar with, but the reality is allergies as defined are an overreaction by your immune system to something that's normal in your environment. That's what an allergy is if you look it up in a medical dictionary. Well, we're not working with the immune system at all. So technically, we're not working with what would be defined as an allergy. However, what we're finding is allergies actually start in your brain. They start as a bad association that your brain makes with something that's normal in your environment. Most people, allergies are something where there may have been a time in your life where you were totally fine with dogs, and now suddenly you're having issues with dogs, and often what we find with people is once there's one allergy in place, often additional ones occur over time. It seems like as time goes on, they snowball and you develop more. You may be shaking your head saying, yep, I've heard that or I've experienced that myself. Well, the thing is, they start as this bad association in your brain, and then it's your brain that asks the immune system to get involved. And so there is a real immune response. There'll be histamine release and a variety of other things that will happen as your body is basically attacking something that it doesn't need to. And so the way that we treat this is instead of working with the immune system, which if you see an allergist, that's their mode of treatment is going to be to focus on the immune system response. Our mode of treatment is to try to help your nervous system to see it as normal again. So what if we can do that? What if we can help your brain go from having a bad association to dogs or cats or whatever the case might be, to suddenly going back to its original program and seeing it as being a normal thing in the environment? Well, if it's normal, then your immune system will never get involved and it'll basically shut off the reaction. So in a nutshell, that's kind of how this whole process works. So the biggest thing with this to have great success is we need to know what it is that you're having an issue with. And that actually is the most difficult part of this whole process. And the reason I say that is because the testing methods that we have available to us today for allergies, none of them are foolproof. All of them miss things, all of them. So if you were to have a skin prick test or a blood test done at your allergist office or at your medical doctor's office, whatever shows up in those tests is truly an issue. Your body is reacting abnormally to those things. But they unfortunately only pick up immediate reactions. So what they'll do is they'll prick your back with a whole bunch of different substances, maybe 30 different things, and then they'll wait 5 to 10 minutes and they'll come back and look at your back and see how you responded to that. Well, the reality is most allergies, and they have a variety of different percentages that they put to this, but it could be as high as 70 to even up to 80% of all allergies are delayed reactions. Well, delayed reactions could delay up to 3 days. So the skin prick test and the blood test are not going to pick up on those things that are not reacting till much later. So that's a deficiency. Now, whatever does turn out on those tests, I am confident that is an issue and we'll want to work with you with those things. But what I'm saying is it also could be missing many other things that your body is reacting to just in a delayed way instead of an immediate way. The other testing that we do here in the clinic is biofeedback testing. And while it's really good, and it does pick up some of the delayed reactions as well, and it's painless, it's very quick, and we can test for 300 different things in about 15 minutes, which is great. Because when you do the skin test or the blood testing, you're only testing for maybe 30 things. Well, we can do 300 things. But here's the deficiency with that particular type of testing. With biofeedback, they have to set a threshold at which they're going to count the reaction. So let's say the scale is 1 to 100. Let's say then that they set the threshold at 50. So what that means is you have to have at least a 50 or greater response to this for it to show up as a positive reading. If you had a 49, it's not going to show up. So what does that mean? It means we miss things. It means anything that does show up, I'm confident that that is an issue. But it also means that because the threshold is where it is, people can have things that are just below the threshold that are truly giving them symptoms and causing problems, and yet it doesn't show up on our test results because it's just beneath the threshold. So unfortunately, the hardest part of this whole process is, and the reason why we don't get even greater success is that it's just hard to find out exactly what a person is having a reaction to. Now, with any of the testing that can be done, that's a good starting place. Plus, we'll take a history and we'll talk through things, and oftentimes we'll be able to come up with additional things that are suspicious and that we may want to look into as far as potential allergies or sensitivities. But that's really the part that is limiting us the most. But even with that, I can tell you that we are having very high success rates with helping people to turn these reactions off. Success rates like 80 to 90%. Again, I think we would be much better, maybe even up to 100% success if we could really nail down specifically what it is that people are reacting to. So that's that part of it. If we have and know what it is, that's the starting place. Then the second thing is the treatment. How we do the treatments are basically we use a cold laser. Cold meaning it doesn't cauterize, it's not hot, it doesn't burn, it doesn't cause cell damage, anything like that. Lasers are becoming much more common and therapeutic, and this particular laser, what we use it for is to carry information to your nervous system. So what we do with the laser is we load the laser with the frequencies of whatever it is you're having an issue with. So let's just pick on dogs and cats because it's an easy one. We'll load the laser with frequencies of cat dander, cat saliva, cat urine, same with dogs, those kinds of things, and then we'll stimulate your nervous system with those frequencies. Now remember, the reason that you're having an issue with this is because you have a bad association. Your brain at some point decided that cat or dog is not good and your body needs to react to it, and it gets the immune system involved. So what we're doing is we're stimulating your nervous system with those frequencies that are related to dogs and cats and their saliva and other things, dander and fur. So as we do that, your brain is picking up on those frequencies and identifying them. So your brain is saying, oh, I know what that is. That's cat saliva, that's cat urine, that's cat whatever. And as we do that, then we're going to stimulate some acupuncture points, different parts of your arms and your feet and along the spine. And as we do that, what we're trying to help your body do is it's recognizing the frequencies, and then we're hitting these acupuncture points that cause an endorphin release in your brain. Endorphins are your body's happy chemicals. Your brain likes these. And so what we're doing is we're trying to make a strong positive association with all the things related to dogs and cats. And this again pertains to whatever it is that we're treating. So really the treatments are the same, whether it's dog and cats or any kind of pollens or any kind of foods. The treatment is the same, the procedure is the same, but what's different is the information that we're stimulating your nervous system with. So anyway, we go back, we do those different points. It causes an endorphin release in your brain. Your brain likes that. We're creating a positive, a strong positive association with those things that you were having a negative association with. Now we need to get them to lock in. And here's the other thing that's really important. So number one was we know what it is. Number two is we got to get this to lock in. How do we do that? Well, your brain actually does a lot of processing when you're sleeping. So what it takes is a REM sleep cycle for your brain to lock in this new response that it's going to have. So what does that mean? Do I have to sleep 8 hours in a row? Do I have to? No. A REM sleep cycle. Generally, most people in an evening when they're sleeping will have multiple REM sleep cycles, maybe 5 or 6 different REM sleep cycles during the night. And you just need one of those in order for this to lock in. But one of the tricks is you cannot come in contact with whatever it is we just treated you for until after your body's locked it in. So what that means is if we do this treatment for dog or cat and you go out to your car and you happen to have a dog or a cat and there's cat or dog fur in the seats and you sit down, you just undid the treatment before it got a chance to lock in. So we'll talk through what kinds of things you need to do to be able to avoid contact. Now some are very easy. If you don't have animals and we're treating you for animals, you just go home. You sleep that night and by the next day, that quickly, your brain has developed a new response. So when you come in contact with a dog or a cat, even that next day, your brain will say, oh, that's fine, and it never gets the immune system involved, and you'll see a real change in how you respond, whatever your symptoms might have been in the past will no longer be kicking in. So we just got to get it to lock in. And so depending on what it is that we're treating, there may be some things that you need to do, like, for instance, dust and mold. How do you avoid dust when you walk out of the office, get in your car, drive home, sleep? How do you avoid dust? Well, actually, it's impossible to do that unless you have like a major hazmat suit or something that you can wear, but that's not necessary. What we usually find is if a person will clean the room that they're going to sleep in, clean it that day, like dust the blinds, vacuum, wash all your bedding, and then put it all back on your bed, come and get the treatment, go home, and you need to stay in that room. And what we found is that it has been successful. If we just do that, you're doing a pretty good job of being in a dust-free environment. Is it absolutely dust-free? No. Doing a really good job of trying to make it as good as you can in that one room. You don't have to worry about your whole house or every environment that you come in contact with, but we want you to go straight home and stay in that room until the next day. And if you do that, we've had great success with being able to help people with that. So the idea behind this whole process is if we know what it is and you can avoid contact with it, you're going to have really good success with this. And I have testimonials over a variety of different types of allergens that I'd be happy to share with you. But that's basically what it is and how it works. Now let me just give you a quick overview of what is it like when you come in for the treatment and how long does the treatment take. The treatment takes only about 5 minutes. Now, the first time you come in, we'll do an extra little pre-treatment. We only have to do it the very first visit, and that is a treatment to help balance your brain, making sure that the right hemisphere and the left hemisphere are communicating properly with each other, because we don't know where this bad association is. If it's on a side that's not getting a lot of communication, it's going to be very hard for us to be able to make the change that we're hoping to make. So we'll do this quick brain balancing technique, then you have to wait for 15 minutes, then we actually do the treatment for whatever it is that you came in for on that particular visit. Now again, we only have to do that on the first visit. After that, you can just come in and get the treatment, and that takes about 5 minutes. So what we'll do is you'll come in, and when you come for the treatment, we ask you to wear a white t-shirt or a white shirt of some sort. It can have writing on the front but nothing on the back, because we're going to use the laser and we're going to go from the forehead down the spine, and we're going to do that 4 times. And each time we're going to ask you to do a different thing. So you'll be sitting in a chair and you'll have your hands just elevated like this with your white shirt on and no socks on, because there's a couple of points that we need to get on your feet. And so you'll be sitting there with your hands like this, and we'll pass the laser down the spine. And then the second time we'll say, okay, now I'd like you to close your eyes, close them and keep them closed. We'll do the next pass. The next one, we'll have you take a deep breath in and hold it. And then the last one, we'll have you blow your air out and hold it. So what is up with all of these different kinds of activities that we're having you do while we do the passes down the spine? The reason we do those is each one of those activities stimulates a different part of your brain. We don't know where the bad association is, so we want to stimulate all the different quadrants of the brain to make sure that we're getting to the area where that bad association is. So we'll do this every single time. We're going to do those same passes that we just talked about. When we do this, afterwards, then, and again, it only takes the 5 minutes, we will send you on your way for you to avoid contact until you've slept, and then we can move on to any other additional allergies you might have. If that's the case, we like to, if a person has a number of different things, let's say you have 5 or 6 different allergies that kind of fall into different categories. Well, we can only do 1 category treatment per time. So again, if it's animals, that's 1 whole category. Cats and dogs are not separate, it's all animals, but we have to treat that once. And let's say you have an allergy to outdoor pollens, okay, that would be a whole separate thing, and we need to do that on a separate visit. Now, so we will do them 1 at a time, and I suggest to people that we do at the most 2 visits in 1 week. We got to give your body time to be able to process the changes that we're making, and we want them to lock in permanently. So we never like to have people do more than a couple in a week's period of time. Although I do have a instance where I would do something a little bit different, and here it is. I've had some patients who come from a great distance. I've had family members of patients that come from Montana, and they came and stayed for a week. And so we did 5 treatments and then sent them home, and I didn't see them again for another 6 months. And then they were able to come back, and we did 1 or 2 more. So if you're from a great distance, we're able to do a few more treatments in a shorter period of time, but then you have a long time where you're not having any treatments and your body has a chance to be able to lock all of those in. If you're local or around this area, then we like to keep it at maybe just 1 or 2 in a week and then process through them. So there are many different categories of allergens, and we try to bunch as many things as we can together to make it as few treatments as possible. But we have some people where, frankly, they're just allergic to a lot of things. Lots of things, many categories. And so for those individuals, we do something called an advanced protocol. The advanced protocol is this. We're going to treat everything. We're going to do all the categories. So the benefit of this is if you have a lot of things, or let's say you know you have several different allergies and you suspect a lot of other things, but we just don't know for sure what they are. If we do the advanced protocol and cover all of the categories, we're basically not going to miss anything. Now, there's no downside to doing the advanced protocol. Let's say, for instance, we're treating you for, let's say, wheat, and you really actually don't have a problem with wheat. Well, it's not going to cause a problem. All we're doing is reinforcing to your nervous system and your brain that this is an okay thing. So there's no problem with over-treating if we were to do that. But in the advanced protocol, we're going to go ahead and we're going to do all the different categories, and that lands somewhere between 15 and 20 visits, actually, to cover all of them. And it includes all kinds of crazy things, including barometric pressure issues and lighting. Some people actually have sensitivity to fluorescent lighting. Some people are allergic to the sun. So then you may be asking, well, how much does this cost? Like, what does it get down to cost-wise? Unfortunately, right now it's not covered by insurance. Insurance companies recognize this as maybe being experimental. It hasn't been around long enough yet where they're actually reimbursing for it. Although I will say that HSA plans, you can submit this because it is being done for a specific diagnosis and done in a professional clinic. It does qualify for HSA plans. Well, if you want to get cost for this, it depends a little bit on how many things that we have to do and that sort of thing. The best way to find out what our current rates are is to call our office, and we'd be happy to explain all of that to you. So it takes very little time. There's no pain involved with it. It's safe. We've been able to do this particular technique on children, and it works very well, and there's no safety issues with it. It either works or it doesn't work. It doesn't cause any damage to anything in the process, so there's really no side effects or downside to it. We're just helping your brain to see something normal again that it should be considering normal, that it may have developed this bad association with. So that's it. That's how this all works. And if you're interested, I always tell at the end of my class, The purpose behind talking about this is not to talk you into doing anything. The purpose behind doing this is just to tell you what we've got, because this is something that very few people know about. The vast majority of the patients that are coming to see us for this are referred directly from people who have had success with this in the past. Allergies are actually becoming more common over time, and we're seeing a lot more of them, and you probably recognize this. I know when I was a kid, there was one person in our whole school that had a peanut allergy, and he had to wear a medical alert bracelet. Boy, now that's not the case. There's a lot more kids suffering from a variety of different kinds of allergies, whether it's latex or peanuts or whatever. Hey, I really appreciate you watching this, what gets to be a little bit of a longer video, but there's just so much great information here, and we are very excited to get this out to people because we really feel like there's a lot of people that we could help, and we'd really love to do that. So what do you do? How do you take the next step if this is something that you're interested in? If you call our office, we'll be happy to schedule a time where we can meet together and talk through things and find out what things you already know that you're allergic to, figure out whether we need to do some additional testing or whether we just need to get started. And so that's probably the next best step to take, is to go ahead and call our office. Also, on our website, there's a form in there, a PDF form that's an allergy questionnaire. That's really helpful. If you can fill that out and get that to us as well, it gives us some clues as to some things that we should be asking historically from you that might give us a little bit more of an idea of some additional things that you could be allergic to that maybe didn't show up on testing, or maybe you've never had any testing done and you just wonder if this might be helpful. That'd be another great step to take, is go to our website and download that PDF file and go ahead and fill that out and get that to us as well. So those are probably the best ways to take the very next step. If you have, or if you know somebody, maybe one of your family members that has some allergies that's really having an effect on their life, boy, I would be super excited about trying to help them, because honestly, this can be life-changing for many individuals. So please give us a call. I would love to be able to help you. Thanks again.